Can I get pregnant on my period? Do I really need an annual exam? These are common questions women ask their gynecologists, but right now you don't have to run out to get the answers because the gynecologist is coming to you. Dr. Nita's here for what we like to call Ask the Gyno. Are you ready?
I'm ready. I live for this.
You're a super gyno.
This is my jam.
I like it.
Let's talk about women's health.
Good at this. Our first guest to Ask the Gyno joins us in the audience. Welcome, Melissa, and thanks for coming. Tell us what's going on.
Well, I had to have a hysterectomy about 4 years ago, and ever since then, it's just been brutal. Sex has been just very, very painful, and it's affecting, you know, my mental state, my physical state, my marriage especially. And I've tried so many different things. I've tried procedures that you bring back your moisture and elasticity, just about anything that I've been able to find as a possible solution I've tried, and I really have had no luck. And it's really important to me to have a very intimate and physical relationship with my husband, and so I don't want to be roommates.
Right. Yeah. And you shouldn't have to be. Yes. So, Melissa, first of all, you are definitely not alone. According to the American College of Obstetricians and Gynecologists, 75% of women experience pain with sex at some point. And typically we call pain with sex dyspareunia. That's the technical name for it. But I want to ask you a few additional questions. How old are you?
I'm 40.
40. And why did you have a hysterectomy?
I had to have a hysterectomy, due to endometriosis.
Okay. And so when you say hysterectomy, that's removal of the uterus. But when you remove the ovaries, that's when you run into issues with hormones and the decreased estrogen. So did they remove your ovaries with the hysterectomy?
Yes, they did.
Which is common with endometriosis because a lot of times that tissue that's inside the uterus that gets outside of the uterus with endometriosis will land on the ovaries, and that's why they will remove them at such a young age. But you're absolutely right. You can get a lot of symptoms, including vaginal dryness. That's a big one. And with vaginal dryness, then you can have pain with intercourse. Now, other things we think about, not necessarily in your specific situation, but we also talk about just decreased overall lubrication if someone isn't having enough foreplay or if they have a lot of stressors in their relationship. Other things we'll consider will be your overall medical history. Like, do you have high blood pressure, diabetes, depression, anything like that?
Well, I mean, I definitely have depression. I mean, that's been onset due to all of the medical issues that, you know, have created this non-physical situation. It's really rough. I mean, obviously I want to please my husband, and so I, you know, will have intercourse, and it just feels horrible the whole time. It kind of just feels like I'm getting stabbed with a knife the whole time.
So it sounds like you're definitely going to need some supplemental estrogen. And that's very common after removal of the ovaries. And I know you've tried that, right?
I've done the estrogen creams, and that's just not been helpful. And it's, you know, this is a really hard subject. It's really hard to even discuss with my husband, of course, to tell him, gee, it really hurts when we have sex. No man wants to hear that.
Absolutely. And I want to say sex isn't everything in a relationship, but it's definitely a big part of the puzzle, and we want you to have a satisfying sexual relationship. I will say I think there is an emotional and psychological component to it because you're going into sex and you're saying, I know it's going to hurt, I know it's not going to feel good. You're scared, and so that's a part of it as well. And so, of course, typically we would do an exam to get a better understanding of what's going on, and I heard you did have an exam by a provider, and we think that a particular procedure may be beneficial in your case because you've gone through all of those other steps.